Hi everyone. This is my random thoughts, part 10. The feeling of warm hands and feet. This was noted by Dr. Simca, a pioneer in the field of CCSVI, as perhaps an angiotensin effect. Angiotensin is responsible for the body's temperature, and we all know that people with MS have a hard time controlling their temperature. Altering the blood flow to the brain or from the brain can increase this. Hence, explaining the feeling of warm hands and feet. As for the general feeling of well-being, it could be a direct result of the liberation and repairing the blood flow from the brain, stopping the reflux of oxygen, poor blood in the brain. But again, we need a lot of studies in this area, as angiotensin is could also play a role in these as well in this area. Fatigue and multiple sclerosis. It has still a relatively unknown cause, and correcting the blood flow from the ventricles in the brain could certainly have an effect on this. But the fact that many patient reports report an immediate improvement of brain fog and energy levels after the liberation procedure or after the angioplasty procedure could rather be attributed to angiotensin. The angiotensin effect as well, rather than anything else. Just better blood flow is just better for all of us in general. Correcting the blood flow does not result in the immediate removal of all excess iron and immediate repair of the damage done by multiple sclerosis, but would rather take a couple of weeks to change. Altering the blood flow volume can alter or increase the function of the hypothalamus, or the part of the brain that is responsible for most neurohormone production. This in turn could lead to the increase of ACTH, ADH, neuroepinephrines, and dopamine levels, leading to the feeling of well-being. If you have the proper hormones going to the proper places in the body at the proper levels, then of course you're going to feel better. It just makes sense. However, a large percentage of patients who have the angioplasty procedure eventually lose that feeling after a couple of months without restenosing. So who really knows what that has to do with, but I'm not going to speculate on that. Certain patients actually report this feeling of a new lease on life and increased energy only after a couple of weeks. This could be interpreted as a direct result of the liberation procedure. A direct result of the treatment as well is the fact that balance, gait, and strength improve after a couple of weeks in some patients. Not all, but some. Is the is the procedure safe? And there are a lot. And are there any long-term complications? Well, balloon angioplasty is relatively safe, and there is little complication to report. If one follows the USA national figures for angioplasty, there's a 2 to 6% severe complication rate, some leading to death, but very few anyway. And I must add that this figure is based on all angioplasty, including heart, people who have had strokes. So it's a lot more serious than the people with MS who are getting the angioplasty, who are relatively healthy by that comparison. Sorry, I'm just reading. And also this angioplasty is in the veins, not in the arteries. So that again is a different factor. The first report of a stent migrating causing open heart surgery, and the tragic death of Holly and Mahir Mustik, Mahir Mustik, who used to live about 15 minutes from me, just so you know. The first report is that Holly's death was attributed to a stroke and not as a result of the procedure. And Mahir's death was due to a clot that formed on his stent due to a lack of aftercare. But the complication was enough to stop Stanford doing the procedure, and that's in the case of Holly's death. But new reports have surfaced on multiple sclerosis. Sites of blood clots developing in a couple of patients, and in a few cases, the clot was severe enough to either cause a lung embolism or a stroke. Fortunately, it was caught in time, and the patients were spared from suffering a severe complication. Most of these clots were reported when the patients had stents implanted. Further complication has also arisen is the occlusion of the stent, and in about 3 cases, open neck surgery was required to remove the stent, and of course the clot as well. In other cases, the stent was successfully opened using another angioplasty, they re-angioplastied the vein, and the stent was reopened. But this complication is serious enough to warrant further investigation in the use of stents and whatever else. A further complication is the rate of restenosis, where stents are not used, and continual ballooning may eventually lead to further complications. Again, it's like predicting the future. I don't know. I guess that's why lottery tickets, lotteries exist, because we can't predict the future. With all of the above being said, there's a definite need to further investigate CCSVI and the procedure to correct this. As Dr. Simka stated, CCSVI is not the direct cause of multiple sclerosis. but rather CCSVI and other factors. It is the only ultimate theory that multiple sclerosis is an autoimmune disease, and CCSVI is rather a complication from this disease and not the cause of it. Treating CCSVI and through aftercare, aftercare may certainly benefit the bulk of our relapsing remitting MS patients, and some secondary progressive MS patients like myself, and primary progressive MS patients as well, or complement the current theories as we know them. We will have to wait for the next round of tests and trials that are currently in the pipeline before we jump to any unnecessary conclusions on this important discovery. Let us hope that this leads to at least a better understanding of multiple sclerosis, or as dubbed by some, the mystery disease, the mystery sickness, and keep the messenger intact, as he might still have something important to say.